All right. Thank you for joining. We're going to go through. We're trying to explore how continuous, how to look at the concept of continuous improvement, right? And our first slide shows the aim of this lecture today. We intend to explore how we can continuously improve service delivery. And again, I must emphasize that we're going to look at all these concepts in line with health and social care, right? So if we look at the concept of continuous improvement, there are a lot of key concepts that have been developed in line with continuous improvement. The first one that we'll look at is the Kaizen approach to continuous improvement. It's simply where the name Kaizen more or less look at a Japanese word. That is just because such concept evolved from the Japanese way of continuously improving their manufacturing sector. It's a way where all employees at all levels of a company work together proactively to achieve regular incremental improvement to the manufacturing process. So if we take the Toyota brand, for instance, everybody, right from the cleaner, from the messenger, from the artisans, from the engineers, those who will be doing the spraying, the electricians, all together working together to achieve regular and incremental improvement to the manufacturing process. And in a sense, it combines the collective talent within the company to create a powerful engine for improvement. How does this Kaizen concept relate to the health and social care sector? Right. If you take the case of the hospital as an example, we've got those who are the receptionists, those who are admin staff, and then we have the clinical staffs, where we have the junior ones, being the care assistants, the nurses, the audiologists, name them, the midwives, and all the nurses, going on to junior doctors, to doctors, the specialist consultants. If they really want to achieve or continuously improve service delivery in the health care sector, then according to the Kaizen concept, all this group must work together so that continuously and incrementally they will be able to develop a continuous improvement system. Why do they do it? They will do it just so that patients who are the main customers or service users will have a good outcome. So the essence of applying the Kaizen method is to make sure that they will continuously improve the services by involving everybody in the hospital so that the end result will be a good patient outcome. A good patient outcome in terms of if somebody has got any condition at home, the person comes to the hospital, he expects to go out from the hospital with a smile on the face. That is the good patient outcome. So according to the Kaizen method of continuous improvement, everybody in the care environment is involved. Right. Let's look at the next slide. There's another concept called the lean management approach to achieve continuous improvement. Again, we will relate it to the care sector. In fact, all such models were developed for the manufacturing and the service sector. And of course, they are all applicable to the health care sector. So the lean management is an approach to running an organization that supports the concept of continuous improvement. It's a long-term approach to work that systematically seeks to achieve small incremental changes in processes in order to improve efficiency and quality. So here the emphasis is on processes, right? So it's quite similar to the Kaizen approach, but more emphasis is on the processes. So if we take the health sector, for instance, what are the processes that goes on over there in the hospital environment? A patient gets to the receptionist, it goes through there to the triage, the person will be referred to the nurses, it will go to the consultant, and then they will decide whether you are detained and then being taken to the ward. And if you go to the system, it's all processes. How are they going to support you in your inpatient stay at the hospital? What about the food that you receive? What about the treatment you receive there? What about your discharge procedure? These are all processes that if we want to achieve continuous improvement, then we should be able to seek to achieve small incremental changes in all those processes. If we do that, we'll be able to improve our efficiency and quality. So you could see that lean management is quite similar to that of the Kaizen approach. Let's look at other methods. So the lean management seeks to eliminate any waste of time, effort, or money. Let's note here carefully. Lean management seeks to eliminate any waste of time, effort, or money. How do we explain this in terms of the care environment? If you look at the accident and emergency, it's accident and emergency, one will expect to go there and then have things done quickly, but you turn out to spend 4 or 5 hours in accident and emergency. So is that really accident and emergency? Why the waste of time? We should be able to look at the booking system and the referral system to make sure that we reduce the hospital time. If you're able to reduce the timing, then we can continuously improve all the other sections so that the patient will have a good experience. So in terms of reducing waste in time, we can also reduce waste in effort, where we'll be duplicating same thing by different staff. And then we can also eliminate waste or money. This can only be done by identifying each step in the business process, and in this case, in the care environment, and then revising or cutting out steps that do not create value. There are so many duplications of efforts that go on through the care sector, be it the care home, the GP surgery, or the hospital. We should be able to find all those unnecessary steps. We identify them and cut them out. And if we are able to do that, we will be able to continuously improve the system. That is lean management. In fact, this philosophy has its roots in manufacturing. But then it's even more important in the health and social care sector, because in the manufacturing, if you make a mistake, you can always rectify it. Either you recycle the output or sell it as store reject. But in the care sector, we are dealing with service users who are human beings. So there is no chance, there is no second chance. We must get things right. So we need to continuously improve the system by making sure we eliminate every waste. That is the mode that lean management seeks to use to achieve continuous improvement. So I want you to be discussing all these key points by linking them to health and social care environment, because we are not in the manufacturing sector, not in any other service sector like the hotel and the rest. This is health care management. So we should be able to link all the explanation to the key concepts to the health and social care environment. The guiding principles of lean management include defining value from the standpoint of the end user. And here the end user in the care sector are patients. Identifying each step in the business process and eliminating those steps that do not create value. Here is the service that we are providing to service users who are patients in the hospital. What are the steps? Maybe a referral from the GP surgery to the consultant at the hospital. What are the processes? Is there any steps that we can eliminate to create value? Right. Is it something that a patient can go to a GP and then thorough investigation is done and the person being referred straight to secondary care to see the consultant? Or how many times is the person going to go to this a GP? For how long the person going to continue going to the GP before the patient will finally be referred to the secondary sector? Are there any steps that we can eliminate so that patient will have quick turnaround so that they will have a good patient outcome? Making the value creating steps occur in tight sequence. We have to make sure that the service that we provide to service users will create value, and that can be done in making sure all those processes occur in tight sequence so that there wouldn't be any lapses. For instance, somebody who has cancer, right? What are the steps that we have to take through to make sure that the person receives urgent care from a consultant in the hospital without delaying much time in the GP surgery until the cancer spread to a stage where it will not be curable? So these are typical applications to the healthcare sector. Repeating the first three steps on a continued basis until all waste has been eliminated. It means that on the first stage, second stage, and third stage, we need to keep on repeating it until every waste in the system is eliminated. Right. Another popular way of measuring quality and ensuring continuous improvement and service delivery is what is called benchmarking. Again, benchmarking has been used in business settings and in manufacturing. It's where key metrics of different or similar companies are compared, so that when there are any lapses in any of them, then such can continuously be improved. You can think of a benchmark report as a dashboard on a car. It measures everything and is a way you can quickly determine the health of a business. So benchmarking is more or less making a comparison about key metrics. What are the key metrics in the health and social care sector? One of the metrics could be maternal deaths or infant mortality in a particular hospital. Another metric could be the waiting time at accident and emergency. We could also look at how long, weeks or months before a referral could go through. So we can compare hospital A to hospital B and C using these key metrics to compare, so that if one is falling short, then we can look at how best we can improve by using others as benchmarks. Right. Let's go to the next slide. We have another method which is called Pareto analysis, which is also a formal technique useful where many possible courses of action are competing for attention. With the Pareto analysis, we try to determine the predominant cause identified. Then we will employ the Ishikawa diagram or fishbone analysis to identify the root causes of the problem. Right, so it's a combination of identifying the causes and then applying the fishbone analysis. Right. This prior to analysis is also used. And what we need to understand here is that there are many possible causes of action that are competing for attention. So if you look at the hospital setup, there are so many sections that are competing for resources, time, and everything. We should be able to use this Pareto analysis to make sure that we'll be able to determine the predominant cause, to identify it, and then we apply the Ishikawa diagram to identify the root cause of problems. And once we're able to identify the root cause of the problems, we'll eliminate it and then continuously improve the services. Right. Another interesting one is the falsehood analysis, which was introduced by Mr. Lewin. Right. We assume that every organization, be it manufacturing, be it the service delivery, be it the care sector, is assumed to have a present state or a desired state. Now, if you really want to improve service delivery continuously in terms of the quality, there are driving forces positive to change. There are forces that we can improve, and then there are other forces that are working against change. So there are two things: positive forces, which are shown in green, and then negative forces, which are painted in brown, which fight against the performance. Right. So you can either reduce those obstacles that are fighting against the status quo or the desired stage, and then improve service quality and delivery. So those things that are fighting against it, you can reduce them, or you can increase the positive forces. Whichever way that we do, we will be able to improve upon the existing state of affairs, which is the present state or the desired state. Let's look at the explanation to get Lewin's model, falsehood analysis. Now, before the change, the false field is in equilibrium between forces favorable to change and those resisting change, as we showed in the previous diagram. There are forces in green which are favorable to change and those that are unfavorable to change. Lewin spoke about the existence of quasi-stationary social equilibrium, which is shown in the previous diagram with the yellow at the center. Right. For change to happen, the status quo or the equilibrium, which more or less is the present stage or the desired state, which is the equilibrium, must be upset either by adding conditions favorable to the change or by reducing forces that are resisting the change. And then a successful change is always achieved by either severing the driving forces or weakening the restraining forces. Can we give ourselves an example? Maybe let's use the delays in accident and emergency as a case to explore the falsehood analysis of Lewin's. Maybe average waiting time at accident and emergency is 4 hours. Right. What we need to look at to improve, continuously improve upon the existing state of affairs, which is continuous, because whichever state that we are, we can still improve and achieve perfection. So let's say that the existing stage is that accident emergency, people go there and spend 4 hours before they come back. What we need to do is look at all forces that can favorably help reduce waiting time. and we look at all forces that try to increase waiting time from the 4 hours to maybe 7 hours. So we have to, according to Lewin, we need to look at things that will improve the existing state of affairs and things that will worsen the existing state of affairs. So if we take waiting time at the accident and emergency as 4 hours, begin to ask ourselves, what are the forces that are likely to cause waiting time to move from the 4 hours to 7 hours? And what are the forces or factors that can cause or help us to reduce the waiting time maybe from 4 hours to 1 hour? The positive forces could be improvement in the service condition for doctors, encouraging out of hours doctors so that they will go to them and not go to the accident emergency, improving, employing more nurses, having more consultants, paying more extra allowance for doctors who do overtime. These are all positive forces, positive factors that can help to reduce waiting time. On the other hand, there are other negative forces or factors that are likely to increase waiting time at accident emergency. Some of the negative forces could be people's habit and attitude in terms of drinking at the weekends and drinking late in the night, which are likely to cause more people to get injured and then come back to accident emergency. Some of the forces that are likely to fight against the equilibrium of 4 hours and cause waiting time to increase might be cut in funding for employing more nurses and agency staff. So you could look at all those factors that are likely to worsen the situation and then forces that are likely to improve the situations. So for successful change to be achieved, this can be done by either strengthening the driving forces or weakening the restraining forces. So in our explanation, if we want to talk about the Lewin's forceful analysis and how we can continuously improve service delivery in the healthcare sector, then we should be able to establish an equilibrium. And then based upon the equilibrium or the existing state of affairs, we can look at all the factors that are likely to sabotage and increase waiting time. If we're able to reduce those factors, then we can bring change and improvement. At the same time, if we look at factors that are supposed to cause positive change and we can increase them, then of course we'll be able to bring change. And if we're able to continuously do that, we will be able to improve patient outcome, which is the ultimate for all health and social care sectors, be it the care home, the GP surgery, the hospital, the hospice, mental home, wherever that service users happen to be. All right. So we briefly look at key terms. And what our advice is that, see, this is not a business management model, and it's a healthcare model. Even though all the models were developed for health and social care, for manufacturing sector, when we are describing and solving our assignment, we should be able to give relevant examples using the Kaizen approach, the Pareto analysis, the lean management, the forceful analysis. Whatever we discuss, we have to discuss it within the framework of health and social care. Right. Let's look at something else. Let's end this slide and let me show you another one. Right. We also like to know how best, if you look at that summit, the need for continuous improvement and how we're able to implement that. So we're going to look at that. Why do we need to continuously improve? Why do we need to continuously improve? We need to continuously improve our quality of service delivery, especially in the healthcare sector. And that will be done by meeting service user needs. We should be able to recognize users of services as individuals, not numbers. People have different conditions, different situations, so we should be able to recognize them as individuals so that we can provide what is called person-centered care, because everybody's problem is unique. So in trying to meet service users' needs, we need to recognize users as individuals. Number two, recognizing and actively promoting respect for diversity, difference, and adopting inclusive practice. Recognizing and actively promoting respect for diversity. We are dealing with service users. You are human beings who are patient. So the essence of continuous improvement is to make sure that we promote and recognize respect for diversity. People are different and they need to be treated differently. And we need to adopt what is called inclusive practice, where views of service users are also included. We should be able to take holistic approach to meeting the needs and safeguarding service users. This can be done by meeting their physical needs, their mental needs, their social needs, emotional needs, and cognitive needs. So if we want to continuously improve, we have to meet service users' needs holistically. So if a patient comes with a headache, we should be able to meet that physical needs, that symptoms, which is headache. But then we need to go beyond that, because the root cause of the pain, the physical pain, that might be social or mental. So we should be able to go beyond that, speak to them, touch on their emotion and their cognitive, as well as the social background. Maybe somebody's headache or stress is all coming from problems at home in terms of the husband-wife relation. It could be joblessness or whatever. So to improve quality of service delivery, we need to take a holistic approach whereby we'll be able to meet the physical needs, the mental needs, the social needs, emotional needs, and cognitive needs, all for service users. Right, let's look at the next slide. Service user needs, meeting their needs. Providing individuals with the tools for self-determination, we should be encourage service users to do things on their own, how best they can overcome their situation, how they can get better. Providing individuals with tools for self-determination. For instance, if somebody has got a problem with addiction, how do we help them to take matters into their own hands? You can give medication advice, but we need to encourage people to take issues by themselves, self-determination. Enabling service users ownership of their own care journey. We don't need to impose what treatment path the patient should undergo. We need to involve them in the decision making. For instance, if you're talking about a cancer patient, the multidisciplinary group will meet. We have oncologists, we have respiratory physicians, and specialist nurses and GPs. They will all contribute. But then, before we decide to put a patient on a care pathway, the patient must be involved. That is what we want to do. Do you accept it? In that way, patients or service users are taking ownership of their own care. Right. Integrating service user feedback and experience into quality improvement. This is something that needs to be done, especially in the care sector. Feedback of service users. If we want to continuously improve health and social care sector, then patients must also have voice. Patient must have voice. Right. So in the UK, the health watchdog has been introduced. And that is more or less the mouthpiece of service users. If things are not going right, things are going wrong. If patients cannot give their feedback, the health watch is able to report such things for improvement. Right, so we should be able to integrate service user feedback and the experience into quality improvement. This is very, very, very important because we can never know the level of satisfaction or patient outcome or patient experience as they go through the health and social care system. The best we can do is to get their feedback, their suggestions, their comments, so that we'll be able to integrate all that into the service delivery. And by doing so, we will be able to avoid mistakes that we do and continuously improve quality of services that they receive. Again, keeping service user at the heart of any quality improvement initiative. The essence of the care system is to make sure service users receive the best. So whatever we are doing, whether we are improving the food people eat at the hospital, whether we are improving the waiting times, whether we are improving services at the ward, whether we are improving the expertise of doctors and consultants. At the back of our mind, we should have the service user as the key reason why we are doing that. So anything that is done in the care environment must have the service users who are the patients at the heart of any decision that we take. Service users. And that is some of the ways that we can improve quality of care, meeting service user needs. What about the impact on service users of improving quality? If we improve quality, how is it going to impact on service users? Number one, it will enhance self-esteem. Service users will be proud of the service that they have received. It will enhance self-esteem, both service users. It will also enrich customer satisfaction and trust level. Patients will be satisfied with the services that they have received. They will have trust in the system, all the processes that goes through. They will trust the consultant that they entrust their life onto. So they will have service user or patient satisfaction, and there will be trust level. Trust level is going to go very high. That will end up improve quality health care. Right. It also lead to improved experience of the service. It will also enhance safety. Service users will trust that they are in safe hands in the hospitals. You not go to the hospitals and go home more sicker than you went in. And they will have trust in the consultants who handle their cases. So quality improvement will end up in enhanced safety for service users. It also enhances clinical effectiveness. In fact, if we're able to improve the quality of service delivery, it will enhance clinical effectiveness. The way things are done in the system, if it's operation, the way things are done, is going to be improved. And it's all quality. The number of patients that die will come down. And that is an enhancement in clinical effectiveness, the way things are done. It will also enhance the relationship with families and caregivers. Right, so in the health and social care sector, it's not only the patient. The patient has got relatives and carers. If we are able to enhance quality, it's also going to enhance relationship with families and caregivers. There are people who are in care. So both families and friends and caregivers will be happy. And it will be a closely knit relationship between the clinicians, the families, and the patient. Right. Let's look at the next slide. The first one was meeting service user needs. Now, meeting staff needs. Quality goes a long way to even affect staff. The needs of staff are also met. Right. Developing and supporting staff through provision of appropriate training, appraisal, and performance management. If you want to improve quality, Some of the benefits will be that it will help meet staff needs. And this can be done through appropriate training, appraisal, and performance management. In the health and social care sector, as I've said, there's no room for trial and error. Because we are dealing with human beings. And when the person gets well, the person dies in the environment. So, to continuously improve means that we'll give appropriate training for clinicians, for nurses, for all those involved in providing service to patients. Doctors, nurses will have constant training. They will have constant appraisal on their performance. And that is going to meet the needs of all staff. And there is also a need to actively promote equality, diversity, and inclusion. People from different backgrounds will work together. Promotion of equality and diversity in terms of different skills coming together. Actively promoting equality and diversity and inclusion. People working together from diverse backgrounds and diverse skills and expertise coming together. And then appropriate delegation of responsibilities. If you are short of staff and you want someone to do it for you, make sure that the person who you are delegating your job to is qualified to do that. If we do that, then we are actually enhancing what quality in the service delivery. And it will also lead to safeguarding staff. Safeguarding staff. Staff are going to be safeguarded. They are not going to be in trouble because we are promoting quality in the provision of service to service users who are mainly patients. So if you're able to improve quality, it will meet the needs of customers who are patients, caregivers, and families of patients. At the same time, it's going to meet the needs of staff. Impact of staff and management of improving quality. Enabling effective working partnership with other professionals. Partnership working and collaborative approach. We work together. Tap expertise and skills from different areas and work together. It will also end up increasing job satisfaction. If there is quality in the system, and people are doing the right thing, and they are seeing results, if it's the waiting time and after an emergency, they've worked out and reduced it from maybe 4 hours to 1 hour. Why won't staff and management be happy? If we have been able to reduce maternal death from maybe 100 per year to maybe 10 per year, why won't staff get this kind of job satisfaction? Because they are there to help human beings. And if they are able to achieve it through quality, continuously improving quality, well, they're going to be happy. And that will mean that if people are happy, their stress levels go down. So another impact on staff and management will be lowering stress level and reducing attrition rate. This is very important. It also leads to improving professionalism in service. Because if we continuously improve service delivery, we improve quality in the service delivery continuously, all the staff are going to be highly skilled and professionals. And that very care environment is going to be a sought after service. People will travel all the way to come and see consultants who they think they can entrust their life onto them because of the quality of their skills and their professionalism in terms of the service that they provide. All this will come about as a result of continuously improving by training, doing appraisal, and updating their skills. Continuously improving. And that will also lead to positive working environment. These are some of the impacts on staff and management of improving quality. What about the other way around? Impact of poor service quality for organizations and stakeholders. As we said earlier on, stakeholders are numerous. In the health and social care sector, the service users are stakeholders, the patient, their families, caregivers, staff, clinicians, professionals. They are all what? Stakeholders. Right? So what will be the impact of poor service quality for the organization and the stakeholders as a whole? We've talked about a lot of gains that service users and staff will get as a result of continuously improving service delivery. The impact of poor service quality is that all the gains that we have mentioned above will be negated with poor quality of service to both stakeholders and staff. And the key thing for the service users who are patient is that there's going to be poor patient outcome, including death. For the organization, poor service quality will lead to organizational reputation at stake. The reputation of every organization will be at stake when there is poor service quality. In the extreme cases, there will be financial loss. The organization is going to be sued. Either the organization is sued or the individuals are sued in the law courts. And in the extreme cases, it might lead to closure by regulatory bodies. Recently, the CQC with the Care Quality Commission has closed down a lot of care homes because of what? Poor service quality that they provide to residents in the care home. There are some sections of hospitals which has also been closed by the advice given by the Care Quality Commission, the watchdog. Why? Because of poor service quality. And as I said initially, the healthcare sector is not somewhere that you can go and try it and see whether it will work or not. In manufacturing, fine, you can try to improve quality. If things go bad, you recycle it, you can even sell it as storage jet or whatever it is. But human beings are not like that. And they are there are people who are sick, who are in pain, who are vulnerable. So we expect to give them the best quality. And the best outcome is to get somebody who is sick come out of the hospital smiling and healed and fit. So poor service quality might lead to poor patient outcomes. Some people go to the hospital with one condition and come out with multiple conditions and infections. And in the worst situation, lead to death. So that is the main thing that will affect service users. And this will impact on caregivers and families. But in the organization, the poor service delivery, if the Care Quality Commission comes in, the organization is going to be blacklisted. And that is going to go against the reputation of the hospital, or the home, or the GP surgery, or the mental home, or the hospice, or whatever it might be. And the foundation, if it's an NHS foundation, they can be sued, and this will be huge financial loss. And the worst of all, it could lead to closure, because once the Care Quality Commission, CQC, come in and recommend that the service that patients are receiving in the hospital A or B, or in the care home A or B, is substandard and is not good and fit for purpose, the facility is what? Closed. So this will be the impact of poor quality service on service users. Right. We're not going to go into that as we discuss all that. There are a few references that you can read to help you. I've put all this in Moodle so that you can access them and then start doing your assignment straight away. In fact, we have actually exhausted all the learning outcome for this unit 6.6. What I will expect you to do is to start your assignment, and if you have any questions and comments, just email them to me. We'll sort it out, and if with me getting online for us to chat and support you in doing your assignment, then we can do that. So what I will do is that next Friday, if you're able to come on, then reserve all questions that you have. When I log on, the first 20 minutes will be used to explain and explore things that you think you don't understand. We'll trash it out Then we'll move on from there, and then I'll do all my best to support you in explaining all that you need to do in finishing your assignment. Right, thank you very much for your time. As I said, I'm going to put all this material or module is there already. So right from the lectures, try and see if you can get this reference list in any library around you, or go on Moodle. There are so many resources that you can read, and then start your assignment. And if you have any questions, then I'll be able to deal with that. Thank you so much. I don't know whether it's Joseph who has come on.
Joseph.
Lovely, Joseph. Thanks for coming. Dr. Matthew is not on it. Wellington is not on it. Lydia is not on it. Christina is not on it. But I believe they will all get all the information on Moodle. So, Joseph, start doing something. And if you have any issue or any questions, just list them down. And then next Friday, when we meet like this, we'll go through all the problems. And I'm going to help you in a way that you'll be able to solve all the assignment brief. And as I said, try to link all your answers to healthcare. So, because all these models were meant for the business and the manufacturing sector. But since this course is health and social care, you need to link it to what happens in the health and social care sector, just as I've explained, right?
Yes.
Good. So thanks for your time, and God willing, next week we will meet.
All right. Thank you very much. Thank you.
All right.
And have a good evening.
All right. Same to you. All right. Bye.
Thank you.